The area of North Lawndale on the west side of Chicago has a poverty rate more than twice that of the rest of the city. It is a food desert, meaning residents struggle to get access to fresh, healthy food. On average, those who live in this neighborhood can expect to live 16 years fewer than those just a few miles away in downtown Chicago. Walter Primus III has turned his front window into a memorial for all those on the block who have passed away, some at a young age due to gang violence. He says one of the issues is a lack of facilities.
Kids, they don't have enough playground, and it ain't enough for them to do when they get home from school.
A recent study has once again underlined health disparities in the US. Research led by Yale University found that between 1999 and 2020, black Americans suffered 1.63 million excess deaths compared to white Americans. Excess deaths are defined as the difference between actual deaths and expected deaths. And those deaths over the 21-year time period studied add up to a cumulative loss of more than 80 million years of life. Aisha Jaco is the executive director of West Side United, an organisation that aims to reduce inequalities in healthcare, education and the local economy on Chicago's West Side.
We've got to look at root causes. We believe that if you look at the economic vitality of residents, their access to education, the neighborhood and built environment, and their access to health care combined, that there is a solution to bridging that gap.
West Side United works in partnership with healthcare providers.
The gap is largely driven by chronic diseases. So if we can close the chronic disease gap, we can close that life expectancy gap. But medical care is not enough. Poverty and racism are vectors for disease.
The COVID-19 pandemic and the disproportionate death toll on black Americans once again thrust the spotlight on health disparities in the US. The authors of this latest report say new approaches are now required to promote health equity in the country. And they're also calling for better ways to keep track of the issue moving forward. West Side United is about to build a new wellness centre in the area, in addition to a grocery store. And the group believes other cities across the country can learn from their experience.
Our goal used to be to decrease that gap by 50% by 2030. Now we want to eradicate the gap.
For this area of Chicago at least, the hard work to close the health disparity gap is underway. Dan Williams, CGTN, Chicago.